Eye Health TV, preventing needless blindness.
The time is 10 o'clock. Here is the news at 10 on RLTV. First, the headlines. NNPC Seplat JV offers free eye care to over 10,000 in Imo State. Oloriomo Bao of Agoiwoyi calls for philanthropic eye health support. Ogbara advocates health over extravagance during celebrations. On the foreign scene, breakthrough treatments reduces vision loss risk by 72%. Trainee bus drivers experience challenges of blind passengers. Good evening. Here's the news in details on ILTV. I am Angela Oluwafagun. The NNPC Limited Seplat Energy Joint Ventures JV recently conducted a medical outreach offering free eye care services to visually impaired individuals in the Ohaji community of Imo State. Through its corporate social responsibility (CSR) initiative, I Can See, the JV distributed over 10,000 reading glasses and performed 639 eye surgeries, including cataract removals for residents who previously had limited access to such essential medical services. Since its launch in 2017, the I Can See program has provided critical eye care for over 20,000 individuals in the Eastern Asset region of NNPC's upstream investments, becoming a significant resource of relief for many. During the event, Bala Wunti, Chief Upstream Investment Officer of NNPC's Upstream Investments Management Services, represented by Dr. Obina Otu, highlighted the importance of initiative to NNPC Limited's mission of enriching the lives of Nigerians. Wunti emphasized that NNPC Limited is committed to being more than just an energy provider, striving to maintain sustainable contribution to the communities it serves. He explained that the I Can See initiative reflects NNPC's belief that corporate organizations should play an active role in societal development. Beyond providing immediate medical care, the program also educates individuals about lifestyle changes that can affect and prevent conditions like hypertension and diabetes, which may lead to permanent vision loss. Wunti expressed gratitude to the local government's beneficiaries and NNPC's partners, noting that together with Seplat, the nation's oil company is working to create a future where access to essential health services is available to all. He affirmed that the project is not only about restoring sight, but also about offering hope and chance for a better quality of life. This year's outreach in Onaji further solidifies the ongoing commitment of NNPC and Seplat to enhance the well-being of their host community. The I Can See initiative continues to transform lives by offering free eye care services, screenings, surgeries, reading glasses, and health education to those in need. The NNPC remains dedicated to expanding the reach of its CSR programs, ensuring more people access Nigerian benefit from these life-changing services. Prince Feishayo Shoyowo, the Oloriomo of Agoiwoye, has urged wealthy Nigerians and philanthropists to use their resources to help the blind regain their sight. During an interview with media on the occasion of his 71st birthday in October, Shoyowo emphasized that those who are well off should not live solely for themselves and their families, but should also strive to help others. Shoyowo highlighted that the country's economy challenges has increased the number of blind people, as many cannot afford eye treatment, let alone surgeries or medications. He commended Honorable Kefilat Ogbara, who represented the Koshofe local government constituency at the 10th House of Representatives, for organizing a free eye camp for our constituents in Koshofe, Agboiketu, and Ikosi to celebrate his 71st birthday. Shoyowo urged other politicians to follow our example in order to reduce the number of blind individuals in the society. He explained that untreated conditions like cataract and glaucoma, which commonly affect people over 50, can lead to not only blindness but increased mental and physical health risks, including hypertension and early death due to the emotional toll of blindness. Shoyowo, who has long been dedicated to supporting physically challenged individuals, shared that thousands of people have benefited from his philanthropic efforts over the years, and intends to continue helping many more. At the eye camp organized by Honorable Kapilat Obara in Agboiketu in collaboration with our health support system, Shoyewo reported that 1,000 eye screenings were conducted, 100 cataract surgeries performed, 200 eyeglasses distributed, and 500 medications provided to those in need. He called on the government to work towards economic stability so that people can afford to prioritize their health. Many beneficiaries of the Shoyewo 74th Eye Camp in Koshofe, Ikosi Sheri, and Agboike to express your gratitude to Prince Feisha Shoyewo for his generosity. In a separate interview with RL Television, Prince Feisha Shoyewo urged society not to neglect or isolate the blind, reminding everyone that blindness is not a choice but often a result of conditions like cataract or glaucoma, particularly in old age.
So the outreach that we started yesterday is for those who have eye problems. You know, I told them yesterday, I said, close your eyes just for 10 minutes. You won't see anything. And you can now imagine how people who are permanently who cannot see at all will feel. So it's just one of those projects that I plan to embark on fully in the years to come by the grace of God.
He emphasized that instead of being left alone or made to feel as though life is against them, the blind should be shown love and support, with efforts made to help them where possible. Shoyewo noted that living in darkness is deeply frustrating for those affected, and neglect from society could lead to depression, thoughts of suicide, or the onset of other health issues worsening their suffering. He praised those who have taken time to assist the blind, acknowledging the challenges of putting aside personal responsibility to care for others who may be seen as a burden. He also commended government officials and philanthropists who have made efforts to help people regain their sight, encouraging even more people to join this cause. Shoyewo reiterated that the government cannot handle the issue alone and called on capable Nigerians to work alongside the government to restore happiness and sight to those in need. Meanwhile, Honorable Kafilat Obara, representing Koshofe local government constituency at the 10th House of Representatives, has urged affluent Nigerians to focus on supporting those in need, especially in matters of health, rather than spending extravagantly during celebrations.
So we're also going to be giving free eyeglasses to 200 people, and then we'll be doing surgery for 100 people free of charge. So the purpose of this program is because my daddy here, Prince Feisha Shoyewo, is celebrating his 74th birthday. And today, as Nigeria is today, there's no better and best way to celebrate a birthday than to give to humanity, than to touch lives of humanity, than to touch the lives of people where it really matters. So Daddy, I want to appreciate you for coming up with this proposal to partner with me so that we can touch the lives of our people. And apart from touching the lives of people normally, you find out that the mood of the nation, you should not call for any elaborate birthday for any reason whatsoever. That money you want to use for whatever celebration, to call Lelere, to do anything, I think you can put that money together and do something laudable like this.
Ogbara made this appeal during an interview with RL Television at the Shoyewo Eye Camp held in Koshofe local government. The camp was organized by Honorable Ogbara in collaboration with RL Support System and other partners to celebrate Prince Feisha Shoyewo's 71st birthday. Ogbara emphasized that politicians must prioritize the well-being of their constituents, especially in terms of health, and also healthy individuals can participate in the democratic process. She expressed a commitment to her people, explaining that this was why she chose to mark Prince Shoyewo's birthday by helping the visually impaired in her constituency regain their sight. During the eye camp, 1,000 people benefited, with 100 eye surgeries conducted, 500 medications provided, and 200 eyeglasses distributed to those in need. Ogbara further highlighted the importance of health, stating that health is wealth, but acknowledged that the economic situation of the country often forces people to prioritize food over health care. She urged politicians to remain loyal to the promises made during their campaigns and to ensure the well-being of their constituents. She also called on other politicians to follow the example of giving back and appealed to wealthy individuals in society to to support the government in improving people's welfare, as the government alone cannot handle all the needs. Finally, Ogbara encouraged the public to use technology to communicate to their representatives, reminding them of their campaign promises and holding them accountable. In the foreign scene, at the 128th annual meeting of the American Academy of Ophthalmology, AAO, in Chicago, researchers has promised and shared a promising development regarding the treatment of demographic atrophy, as advanced form of dry age-related macular degeneration (AMD). Geographic atrophy, which leads to irreversible vision loss, affects around 5 million people globally and causes 20% of legal blindness in North America. Currently, no approved treatment can preserve vision in patients with these conditions. However, a new hope emerged as data from study presented at the meeting showed that patients receiving monthly injections of ANX007, an investigatory drug, had a 72% reduced risk of vision loss. The study also demonstrated that crucial areas of the retina necessary for good vision were preserved. Dr. Ahu, a leading researcher, emphasized that these findings are significant, providing optimism for patients struggling with demographic atrophy. According to him, ANX00 works by targeting the complement system, specifically blocking the immune macular C1q, which believed to drive retina degeneration.
How did iDose do in patients that had prior SLT, in particular those that had failed prior SLT? And the good news is it works. And we know that prostaglandins work. We also know they can be tough on the surface of the eye. And so what we hope for is that by putting the travoprost directly inside the eye, we get better access to the trabecular meshwork with lower doses and don't have to fight the barrier of the cornea or the side effects that come from applying a drug to the ocular surface. And indeed, that was the case. And there's actually other data out there that shows that in those big trials, the intracameral delivery of prostaglandins show that it lowers IOP even further. So it's good news for us. It's good news, most importantly, for our patients, that in these difficult to treat patients like those that had a prior SLT, or maybe even in those that prostaglandins aren't quite good enough, that the iDose can help us in those situations.
The study also revealed that ANX007 help protect photoreceptors in the retina central region, which are vital for vision. The treatment has received fast-track status from the FDA and prime designation in the European Union, accelerating its development. A larger phase 3 trial is now underway with results expected in 2026. Dr. Nathan Redcliffe, a cataract and glaucoma specialist based in New York City, has shared insights on why eye doctors should consider early cataract extraction for patients with angular closure, elevated pressure, or angle closure glaucoma. Redcliffe, who practices at New York Ophthalmology and the New York Eye Surgery Center and is affiliated with Mount Sinai School of Medicine, highlighted several studies supporting this approach. Dr. Redcliffe pointed out that the alternative to cataract surgery is the use of laser iridotomy combined with medicine. He noted that the data supporting laser iridotomy isn't particularly strong, citing the ZAP study, a prospective trial that compared iridotomy and cataract surgery in patients. Redcliffe explained that only a small number of patients benefited from the laser treatment. The study showed that 50% of patients had to be treated with iridotomy to benefit just one. Redcliffe emphasized that there are no approved IOP-lowering medications specifically for angle closure glaucoma, and most medications used are off-label. He referenced the Eagle trial study comparing laser iridotomy with cataract surgery. He recommended cataract surgery for patients with angular closure who have optical nerve damage or are on the multi-pressure lowering medications. He added that even if the cataract is not visually significant, the surgery is still beneficial for a medical perspective. Dr. Redcliffe also addressed the risk associated with cataract surgery, which experienced surgeons consider minimal at less than 1%. While there is a slight risk of inflammation or need for a second surgery, most patients actually experience a reduction in glaucoma symptoms.
Early cataract extraction for patients with angle closure, elevated pressures, or angle closure glaucoma. And there are actually a few good studies on this topic, but I like to start with the alternative to taking the cataract out, which is to use a laser iridotomy and place the patient on medications. The data for laser iridotomy isn't that strong. This was looked at in a study called the ZAP study, which was a prospective study where patients had iridotomy in one eye or cataract in the other. There weren't a lot of people that benefited from the laser, and in fact, you needed to treat almost 50 patients in order to benefit one patient in terms of the study's outcomes. There are no approved IOP-lowering medications for angle closure glaucoma. We're using them all off-label.
It concluded by stating that in a 10-year comparison between iridotomy and cataract surgery, patients who underwent cataract surgery extracted better, needing fewer medications and having fewer causes of vision loss. RNIB Scotland is celebrating its 50th Swap With Me events this week, where trainee bus drivers from across Scotland are gaining insights into the experience of blind and partially sighted passengers. These initiative sessions aim to help drivers better understand how they can make bus travel more accessible for all. The 50th event took place in Aberdeen with first bus drivers. In a research made by RL Television, made it known that Scotland is home to approximately 183,000 people with significant sight loss. Since the initiative began in 2023, all 500 drivers from Luton Buses, Bus, and McGill's have participated. During the sessions, RNIB Scotland volunteers share the challenges they face when using public transport, offering guidance on how drivers can assist. Participants wore stimulation glasses that replicate various vision impairments, allowing them to experience common difficulties such as hailing a bus, purchasing a ticket, and boarding. Drivers who spoke to media made their role in improving accessibility known, while passengers with sight loss were given the chance to sit in the driver's seat to understand the driver's perspective. Some of the participants who spoke to media highlighted the value of the informal setting, saying it allowed them to have honest conversations with the drivers about the difficulties they face. That was the news at 10 on IF TV. I am Angela Luafagwangwe. Good evening.
iHealth TV, preventing needless blindness.